Well, when you're able to reach and target like that, you're reaching facet joints, you're reaching deep into extremity joints, right where the cartilage is, allowing the electric field to interact with that cell, and then to begin to turn that pathway around to the benefit of the patient and reduce inflammation.
Hey everybody, as promised, I am here with Dr. Scott Munsterman. We're going to be talking all about Novo Pulse. You might not be familiar with Novo Pulse, but you certainly are familiar with osteoarthritis. We're going to showcase how and why Novo Pulse is just such a fantastic solution for those patients dealing with OA in your practice, and how it works, how it can impact your practice, and ultimately how it can help a lot more patients in your community by really positioning yourself. So, Scott, I'm going to ask you to kick it off with, from your perspective, how big is the osteoarthritis problem? Why is it one of those big missed opportunities in conservative care today?
Oh, my goodness. So, according to the statistics, there's over 75 million people, and I think that's understated, but that have OA, at least some form of OA, whether it's a mild, moderate, or severe form of OA. And of course, as we've learned as clinicians, we've understood that injuries can lead to damage to cartilage, which, as we know as clinicians, is largely avascular. And so it's going to rely on any type of imbibing nutrients to get into that area for those cells to repair. Well, many times they don't repair and they continue to degrade, and the body's ability to be able to clean, those dead cells out and replace it with new cells, it's just a very slow process. And so over time, we have that degenerative type of situation that occurs. And we've got a cascade of events that lead us, especially when we get into our 40s and 50s and 60s on up, we begin to feel it in our joints. And our patients are those folks that have OA to some degree, a large percentage of them. And for us as chiropractic physicians, as we look at the biomechanical structure and working with the joints and normalizing that structure and function, many times OA in a joint, whether it's an extremity joint or a facet joint, really gets in the way because that's that inflammatory reaction that's there. We're trying to get our job done, and it can result in a very slow recovery or even a point where there's chronic pain that we can just not seem to get rid of for patients or to help them get rid of. And that's where the Novo Pulse is really shined.
I've been really impressed as I've learned, and I got a feeling there's a lot of docs that ears just perked up as you started to describe a lot of patient type and symptomatology that they see day in and day out, and probably haven't thought of in this type of specific way. And let's tie that directly into Novo Pulse. For somebody who's never heard of Novo Pulse, how would you explain it in simple terms? Then we'll get into the details.
Yeah, well, it's actually a pulse electromagnetic field device. However, what the founders and inventors did with this is that they created a unique electric field out of that. They went in and they looked at all the research in regards to the electric field that actually changes cartilage cells. Now, the interesting thing about that is that and this was relatively new, and I'll be real brief with this, but what was discovered recently, when I'd say over the last probably 5 to 7 years recently, was the adenosine A2A receptor anti-inflammatory pathway, that there's a pathway that can be interrupted and changed. Well, in order for that to happen, and it can happen with electric fields, but that electric field has to have the right unique nature to it in order for it to interact with the cell. So for instance, cartilage cell or any cells to interact with the electric field, it takes a minimum pulse width of 5 microseconds. And the other thing is that many times with electric fields, they only go so far and they get absorbed by bone or dense tissue or that type of thing. Well, what they figured out with the Novo Pulse was how to bring that electric field to have it potentiate at a depth of, it was been measured at 7 centimeters in the body, where they actually have that interaction occur. Well, when you're able to reach and target like that, you're reaching facet joints, you're reaching deep into extremity joints, right where the cartilage is, allowing the electric field to interact with that cell, and then to begin to turn that pathway around to the benefit of the patient and reduce inflammation. Now, in the labs, and this is not the device I'm talking about now, but in the labs and the research, they actually were able to show cartilage regeneration through MR scans and Mankin scoring and all of that. And so that has not been tested on this device yet. However, this device is built based on what that research, has demonstrated the electric field needs to be. And it's actually more potent than what they used in the research environment. So, very exciting with what was discovered and then how they took that information and put it into a device that can be used.
Yeah, that is powerful. And I think that's really a differentiator. And we're going to dig a little bit deeper on it. There's a lot of docs out there that are familiar or have looked at or maybe implemented laser. Maybe they've implemented shockwave in their practice. Maybe they even have or have heard of another PEMF device. You referenced it briefly, but I want to dive a little bit deeper. Novo Pulse has patents on this. And I just would like you to spend a moment or two diving into, okay, how does that actually differentiate? And you just highlighted some of it, but this is a patented device that really addresses things in a distinctly different way than the modalities that I just discussed. What does that make you think of when I say that?
Yeah, well, to your point, it's backed up by 6 patents, unique patents, for spine, for extremity. It's backed up based on the type of electric field that I briefly described there. The other component that they brought in, which I didn't mention, but I will now, and that's the thermal activity that goes along with that, which has been shown to be a very high synergistic component to electric field stimulation. And so, yeah, it's just the uniqueness of it, taking something that has been out there, but then being able to design it in a way that will allow the body to interact with it and in a very targeted, specific way.
That is one of the unique aspects that really caught my attention as we started discussing and I started learning about Novo Pulse late last year, was really getting a true understanding of the depth of differentiation, what I'll say. And even if a doc has some of these other modalities in their practice, Novo Pulse is really separate and distinct because of much because of the patented technology and approach that it takes. For docs listening and thinking, okay, I'm starting to put this together. I do chiropractic adjustments. Maybe I do some rehab. Maybe I do some other modalities. How do you see and where do you see Novo Pulse fit in alongside or with a typical chiropractic practice?
Oh, like I mentioned earlier, and I'll kind of dive into that a little bit more. It does not replace the chiropractic adjustment. It does not replace any soft tissue work that you're doing to normalize, neurological function, neuromuscular function. What it does do is that it reduces the inflammation within that joint, and it helps those tissues to interact with that electric field to repair themselves. I mean, it stimulates that because it interrupts that anti-inflammatory path or that inflammatory pathway that we mentioned earlier. And so it whether the patient is acute or chronic, and maybe even has OA that's evidenced by X-ray, it becomes a mainstay treatment and even maintenance therapy moving forward, so that you can manage and control that while you get the body structure, the biomechanics normalized for the patient the best that you can. And so from an adjunctive perspective, very specifically, that's where it comes into play. My early experience, just as a sidebar, if I may,
please,
when I became familiar with the Novo Pulse and the founders, who are honestly rocket scientists. I mean, they're nuclear physicists. They've been in the field for like 40 years. They have over 120 patents. I mean, these guys are amazing. Anyway, I had difficulty with my lower cervicals, facet arthrosis, to the point where I was getting radiculopathy, and I mean, I felt like my shoulder was going to blow off. Honestly, tried everything, did traction, adjustments, all of that. I practiced in a surgery center, and so I ended up seeing one of the pain management anesthesiologists. They ended up injecting my facet joints, which brought it like from a 8 or 9 down to like a 3 or 4, and then it just stayed there, on the pain scale. And as I started learning about this, I thought, and then my neck started to kick up, and I thought, okay, well, let's try this thing. Let's see if it works. Within 3 weeks, my pain was completely gone. And then I left it alone. And it was about a year later, I felt it start to come back, like, oh, I can feel this, put it on again, and it was gone. And what was interesting about that, my experience matches what they found in the research with this type of electric field stimulation, that when they put people through treatment and then they did it like in a 6-week trial, okay? And then what they did is they did a 1-year follow-up and they did a 2-year follow-up. Their pain scores and their function scores remain relatively stable. I mean, how many therapies have we used over the years that, and even like our adjustments that we can say that, a year or two down the road, that they're good. Now we can say that, I think, overall for our adjustments, but there are cases where that they have ongoing problems. If they don't get treatment, they're going to regress, within a certain time frame. Well, this gives you a pretty good clue as to the effectiveness of this type of device and what it actually does to help break up that inflammatory pathway and cause, some reparation to occur, within that cartilage tissue. So, it's in terms of what we can do in practice and how we utilize it in practice. Honestly, it becomes a very necessary adjunct. If you've got joint inflammation, the patient's in an acute or subacute situation, it's relevant. If the patient has chronic pain, maybe due to OA or whatever, it becomes relevant. It even becomes relevant that for patients who have, let's say, moderate OA or have, continued problems, that they can utilize this at home, and that's one of the unique things about this device. It's very simple, and patients can purchase it from their providers and use it at home. So yeah, just a wide range of things.
Yeah, you're describing just an overwhelming majority of the patients that go into so many chiropractic practices each and every day, and really being able to have an additional opportunity to help them, not only in the short term, but as you described, also in the long term, in a way that I'm going to say complements a lot of what you're already doing. I think is really just fantastic. And for docs listening and watching, we're going to make sure to drop a link down in the show notes. So if you'd like to connect with the Novo Pulse team and understand how this would fit into your practice, please connect with them at the link down below. And on that note, I want to take a moment to discuss really what I call the system. You highlighted to me a little bit behind the scenes of, Novo Pulse. There's a device component to this, but there's much more. And you've spent a good amount of time, effort, and energy building just what I call a fantastic resource library that enables a doctor and their team, docs and your team, to be able to step in and understand how to utilize this, how to speak about it, and additional continuing education. Maybe I'll just pause for a moment and let you sort of highlight some of the Novo Pulse Education and Resource Center that I have seen, and really some of the tools that are available to Novo Pulse doctors.
Yeah, thank you for that. Well, the team at Novo Pulse, said, hey, this isn't just about a device. This is about treating patients, meeting them where they're at, and helping everybody understand, there's a multifaceted approach to pain management. And so what we did was we brought in pain management modules, training courses, how to utilize the device, different patient handout, all of those things that you can wrap around. And we call it the Novo Pulse OA Pain Recovery Center. And we even took the step to say that, look, if our clients, and we call docs who purchase devices from us our clients, because they're our clients. We have that kind of a relationship with them, that if our clients would like to open a new service line within their practice that is a OA Pain Recovery Center, here it is. They get access to the dashboard. They have all of our training modules. Their staff can learn about pain management, and how to utilize the device. What's the best way to incorporate it into the practice? Who are the target patients, if you will, that you can help identify, utilizing pain assessment tools, all of that. And so we do have a pain management certification course for the doctors. It's approximately 15 credit hours that we do provide CE for, so that is an added component, if you will, for the docs. But it's really getting everybody on the same page when it comes to pain management. And there's a lot to know and understand about that, because pain can be derived from a number of different ways. Well, understanding that and then being able to use appropriate resources in the practice to help that patient, becomes important. And so we step back and realize that, look, this is going to take a comprehensive approach. Yes, our device is central to this approach, but then we wrapped it around, the knowledge base has been very helpful for our clients as they move forward in using it.
Yeah, I think it's really fantastic because there's so many docs out there that purchase a new modality, maybe at a seminar or wherever it might be, and then they're never just able to get it implemented because they bought a device, not a system. So I'll tip my hat to Novo Pulse in yourself for really developing that OA Pain Recovery Center, because it gives the doc the opportunity to have a holistic understanding of how to approach implementing this in their practice, which is just so critical, because that's what takes a really good idea into something that can actually help people in the community. And with that, I just want to touch on, for docs listening, watching, and maybe unfamiliar, this is something that the patient can wear on their belt, so to speak. So as you visit the website link, you will see all the pictures. You'll be able to see it. But this is really something that, it doesn't take up a lot of real estate in the practice. You don't need to, devote an entire room to the unit fits
Right.
on a belt pack, so to speak, or on the belt. And then goes from there. Now, with that, one of the things I just wanted to touch on briefly are just talk loose business sense and revenue case. This opens up, you mentioned it, a new line of potential business into their practice. You also mentioned, being able to sell it to a patient. I just would like for you to highlight some of the opportunities and options, whether a doc wants to deliver the care in their practice, resell, rent the unit. How does that work, and what does a doc need to know?
Yeah. So yeah, you covered a number of it. So we'll drill down. So it can be utilized as an in-office, procedure. It's unattended, and it's 30 minutes, because that's what the research has found, is that 30 minutes allows for everything to, cartilage interaction with the electric field and all of that to get the best benefit. The research from an in-office perspective has been based on 3 times a week for 6 weeks. Protocol, and then reassessing at that time. Generally speaking, some patients, if they don't have a huge amount of inflammation and big problems going on within the joint, they'll see a return in terms of their pain reduction and function returning, relatively quickly, within a week or 2 or 3. Everybody else, you'll begin to see function improve by week 3, 4, 5, 6, and then the clinicians can decide, okay, should we continue with this, to reduce rate, or are we clear, if you will, and don't need it at that point anymore. So in office, what we recommend is utilizing the unlisted procedure code 97039, because it is a unique electric field. And so that's how it can be done. And that could be billed either through, payers, or, just on a cash basis, and they can price it accordingly based on, maybe other modalities they have. And we don't get into telling people what, they should charge, obviously, but your in-office procedures, there's number one. Number two would be, you could also have multiple devices, which a number of our clients do, and they rent out the device to the patient, because especially those patients that are a tougher case, that and maybe they can't, make it in 3 times a week or whatever. So then they rent it out on a weekly basis or a monthly basis, or for like a 6-week program for a certain amount. And then the patient, pays for that. And then obviously then they can renew it at the end of that. And so that's another way. And I mentioned earlier, pretty straightforward on how the patient can use it. There's one button. It's hard to mess that up too bad. But yeah, and then the patients utilize it. And then the third part that you alluded to has to do with patients saying, how much does that cost? Because I think I want to buy one of these. And I would say that occurs probably 5 to 10% of the time, so it's not like it's a lot, but there is some revenue generation for the doc when it comes to any of those 3 fields. And then we work directly with clients to let them know what that means, for them. We help them figure out their ROI, but the return on their investment, their return of their investment, which means when do I get my money back, usually occurs anywhere from that 3 or 4 month range, which is fairly quickly, with a close to a $6,000 device. And then past that point, it's a return of their investment for that amount, what they generated each month. And so our clients do pretty well with the device. They know when to use it. They've been able to talk to patients about it, and then, use different types of, like we have a poster and we've got, different things that will help them describe the patient. Here's what we're going to do with you because of this, this, and this. We're going to utilize this therapy and this is what it does and all that. So yeah, but those would be the three primary areas from a business model perspective that helps you keep it in your practice and make it viable for your practice.
Yeah. Yeah, it's fractional compared to so many other modalities out there, and the need is so high. This is not a niche of 1 in 1,000. This is probably an overwhelming majority of many patients that are coming into many chiropractors' practices each and every day. Also want to give a thank you to you and the Novo Pulse team, and also just let everybody know, as a partner of the evidence-based chiropractor, docs that connect with the Novo Pulse team can have continued access to that resource center. Mm-hmm. So you're going to have the opportunity also, for the cost of the unit, to also have access to the entire pain recovery center, all of the resources, tools, marketing, clinical, CE, as you mentioned, all wrapped up in a really wonderful opportunity that enables you to help more people in your community in a very distinct way. So, Scott, I really appreciate you taking some time and coming on and chatting today with everybody. And I'm going to encourage everybody listening and watching to click on down below, connect with the team, ask questions, discover how this can fit into your practice, because it's a change that you can make that really opens the door to a tremendous amount of opportunity in your practice from a business sense, but I would say most importantly, from a clinical sense, being able to help people with a lot of specificity. So, Scott, I really appreciate you coming on and chatting today.
Well, thank you very much, Dr. Japp.
Thanks so much for checking out that interview. If you liked it, we have plenty more available. You can check out the next interview right here.